for everyone. Why? Because if you can afford it, if you have IGS or Social Security, you go to IGS. If you can afford a private hospital, private doctor, you go to a private hospital or doctor. And if you're really poor in rural Guatemala, you have no access to health care. So basically, the Ministry of Health treats that middle or lower middle 35% of the population that cannot afford to go to private hospitals. They do not have formal jobs to go to the Social Security system, and they actually have access to a clinic or a health center or a hospital from the Ministry of Health. The military system is very similar to the VA, but they only see 0.5% of the population. Social Security system, they have a similar budget to the healthcare system of the Ministry of Health, but and this is also very sad, only 18% of the population has formal jobs. Everyone else, either they're unemployed or, kids or retirees. But for the most part, workers in Guatemala are excluded from the formal system. So they are selling stuff in the market or washing cars, or cleaning houses, and they do not pay taxes, they do not get benefits, and they do not have access to the Social Security system. And then a huge portion of the expenditure in healthcare in Guatemala is made privately. So people that can afford a doctor or people that can afford insurance, then they pay into this. And then the budget or the amount of money spent in this is about $3 billion for half of the people. And this is where we include hospitals, clinics, NGOs, and alternative medicine. It can be stuff that you see here in the US, like chiropractors or homeopathy, but for the most part is Native American shamans and stuff like that. This is the same volcano we had before. This is the Fire Volcano about 3 months ago now. In June 26th, it made a massive eruption. It is an active volcano, and the other picture, you can see how it went vertical. This eruption went sideways, so that's the most dangerous type of eruption. There was a huge pyroclastic cloud that killed hundreds of people. You can see here how the volcanoes on the right are dwarfed by the size of the pyroclastic cloud, and it not only went really fast, it was a very hot mixture of lethal gases, but it went really far, so it completely destroyed some villages. So this is the Ministry of Health system, so free healthcare for all. It's not really free, because what happens in real life with free healthcare in Guatemala is that patients go to the hospital and then their family members are given a list of medications and they're given a list of supplies that they need to buy because the hospital has nothing. So free healthcare, that's why I put quotes on free, and care, because a large part of the population has no access to seeing a doctor, even free healthcare system, clinics from the Ministry of Health or healthcare posts. A large part of the population, because of the problems with access, and a lot of people live in rural areas without roads, they have no access to this. So it's very sad. These are the numbers: 0.3 hospitals, 0.6 health centers, and 7 health posts per 100,000 people. Vastly understaffed. These doctors make very little money. Most of them, they work in this system because they want to help their populations, and they have second jobs in private clinics. So it's mostly trainees from the different universities and medical schools. It's extremely destitute of resources. So that means that even though healthcare is a right in the Constitution of Guatemala, in reality there is no universal access. And this complements what Dr. Snell was saying. Universal health access is not just putting in your Constitution that healthcare is a right. It's actually doing that. So here we have some pictures. This is a picture we took when we visited last year. Very sad case, a 3rd-degree burn that's dressed with diapers because they have no gauze, no sheets. All they had to cover them was diapers. This is a hospital in Lake Atitlan. They built a new hospital. They have no beds, no medicines, no supplies. So when we went to visit, it's empty. There are not even patients, and all we saw, this is the OBGYN room with 1 bed that doesn't even have sheet, no patients. And this is the same hospital, San Juan Hospital in Zone 1, Guatemala City. And this is just everyday life in that ER. Completely packed. They turn away a lot of patients, so these are the sickest patients. You can see here a patient coded, and that medical student is doing CPR. Again, not a single attending to be seen. This is Lake Atitlan, 3 nice volcanoes around it, also very touristy. Highly recommended if you go. Now, Social Security, this is a little bit like the Bismarck system. So here, both the employer and the employee pay 6 to 7% out of the salary, and that gives the worker access to Social Security. Their wives, when they're pregnant and for delivery, they have access to the system, but otherwise they have no access, and children only up to 5 years old, or if they have a congenital problem, then they have lifelong coverage. The budget is about the same as a healthcare system for the Ministry of Health, but they have less patients, so it's usually better staffed and more resources, but it's still, by US standards, extremely lacking, and most of the healthcare is provided by trainees. And here, the problem with the Social Security, it's been historically an extremely, extremely corrupt entity. They have at the board of directors representatives from the president, from the Bank of Guatemala, from the public university, College of Physicians, workers, and employees and employers. They all have a seat at the board of directors, at the table of the board of directors, so it turns it into an extremely political entity. And right now, the entire board of directors, the previous board of directors, they're all in prison, including the dean of the medical school. Well, he just committed suicide in prison, but all of them were in prison for corruption. This is me back when I had hair. This is about 14 years ago. I was a medical student in Antigua Hospital. I did my OBGYN peds and internship there. This is the ER, and a lot of unsupervised practice, which is very good for learning. Now, the private healthcare, there's everything from cheap hospitals and cheap doctors to very expensive hospital doctors, procedures, clinics, MRI, CTs, whatever you want, as long as you pay for it. So the private insurance companies are $300 million a year business, but only 6% of the people in Guatemala can afford it or have it. There's also a lot of NGOs. The main one is APROFAM, is Asociación Pro Familias, Pro Family Association, very closely linked to Planned Parenthood here in the US. And here are some, this is a pediatric room in a private hospital, the Multimedica is private clinics, and Centro Médico, big private hospital. And then for medical school, even though it's almost free, it's $10 a year, but then they get you. Right before you graduate, the last year you do social service for 1 year, so you do 6 months in a hospital and then 6 months in a rural clinic. So this is me doing the social service 6 months in rural Guatemala. It was a beautiful experience, and this is the nurse and the tech that worked in the Centro de Salud or health center. And then to put this together with the payer system and insurance models, so the public payer with public employees would be the Ministry of Health. Public payer with private providers is when they contract services, which is pretty rare and difficult to get. Private payer with private providers, you have the Social Security system, and then private insurance companies. And this is me also doing the social service. You can see here one of the examples of how a Mayan kids dress. Super beautiful, very nice people. And now I'm involved in creating emergency medicine as a specialty in Guatemala. We're starting the first program next year. We created, we planted the seed for the College of Emergency Physicians in Guatemala. We called it ACME. This is our website and our Twitter handle, so please follow us. And if you're interested in helping out, you know where to find me. Thank you.